Thank you for joining Cancer Support Community Atlanta for Cancer Survivorship, facilitated by Kennon McCollum, Oncology Nurse Practitioner with Georgia Cancer Specialists. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs.
Welcome, everyone. This is Emily Brown. I'm the Program Director at Cancer Support Community. Thank you for joining us this morning for this presentation on cancer survivorship in 2020, presented by Kennon McCollum of Georgia Cancer Specialists. Kennon is a nurse practitioner with GCS, and we are so grateful that he is available to do this presentation for us today. So again, if you have any questions, please submit those to the chat box, and we will be answering those questions at the end of the program. And I hope you all enjoy. Kennon, you can go ahead and get started.
My name is Kennon McCollum. I'm a nurse practitioner with Georgia Cancer Specialists. I practice over in the Stockbridge office location, and I was approached this week by Cancer Support Community to talk about cancer survivorship and what that really looks like in today's world. So that's the title of our program tonight. This morning, Cancer Survivorship in Today's World of Cancer Care. Understand we have a large audience that's a mixture of oncology professionals as well as a number of patients who are actually cancer survivors. So really what this program is centered around is really talking about, what is cancer survivorship? What does it mean to be a cancer survivor? What is the definition of survivorship? And really talk about some of the statistics around cancer survivorship and talk about some of the various models that are out there and practices for delivering survivorship care. So that's the ground that we're going to cover this morning. And I think when we begin any discussion about cancer survivors and cancer survivorship, one of the first things we have to do is really define what is survivorship. If you look, for various definitions of survivorship and cancer survivor, there is a multitude of different definitions out there. I really like this one from the National Cancer Institute. This was their 2014 definition of survivorship. They define a cancer survivor and survivorship as one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. In cancer, a person is considered to be a survivor from the time of diagnosis until the end of life. And the reason I really like this definition is because it really defines a cancer survivor as being a survivor at the time of diagnosis. And that is kind of keeping in line with Northside Cancer Support Community's definition of survivors, in that a cancer survivor becomes a cancer survivor from the time of diagnosis. And what we're going to talk about in some upcoming slides is there are different stages to survivorship, and that goes throughout the cancer continuum from the time of that diagnosis really through the end of life. So why is cancer survivorship such an important topic? If we look at this slide really shows the increase in number of cancer survivors really going back to the 1970s. The good news on this slide is in each of these time brackets, you see we have more and more patients who are surviving cancer. And if you pay attention to the colors, particularly the teal color at the top and the purple color, those are patients who are long-term survivors, patients who are surviving cancer beyond 10 years and even 15 years. And what's good about this graph is we see with each of these time blocks, we have more and more patients who are surviving and living longer. But the purple and the teal color show us that not only do we have long-term survivors, but we have survivors who are surviving long periods of time, 10 years or more. And the very top part of the graph, the blue part, shows those patients who are living 15 years and longer. So not only do we have more and more survivors, but survivors are living and surviving much longer with a cancer diagnosis. I began working with survivorship around 2010, and by the end of 2013, when I completed my project for survivorship, the estimated number of cancer survivors back then was around 13 million. And you can see at the top of the slide, it talks about the projected number of cancer survivors in the year 2022 will actually be closer to 18 million. So that means by the year 2022, we will have over 18 million people living and surviving with cancer in the United States by the year 2022. So if you think about, male survivors of cancer, it doesn't surprise me that prostate cancer is the most common number of patients who are surviving that are male patients with prostate cancer. Though this is data from 2014, I certainly think it would translate into 2020 that prostate cancer still remains the most common form of diagnosed cancer in men. So therefore, it would make sense that the largest majority of cancer survivors are prostate cancer survivors. That's followed by colorectal and melanoma, with colon cancer survivors comprising about 9% of cancer survivors, melanoma around 8%, and then bladder cancer being 7%, and then all the other cancers to the order of 4 to 3%. So if you can imagine that prostate cancer is the largest number of cancer survivors for males, and females, the largest number of cancer survivors are breast cancer survivors. If we look at the percentage of survivors for breast cancer, it's around 41%. What's different in female survivors is the second most common group of survivors for females is females with uterine cancer, followed by colorectal cancer, and then melanoma, with all the others falling in to the order of 6 to 3 to 4%. So some of the differences between the number of male cancer survivors and female cancer survivors is the second most common group in female cancer survivors is uterine cancer. And you see a little bit higher incidence of thyroid cancer in females than you do in males. So that should give us an idea of really where cancer survivors are and the type of cancers that they're surviving. Even though this data is from 2014, I think it still translates to 2020. If we look at cancer survivors by age group, this is an interesting graph. It basically breaks down the degree to which cancer survivors are grouped into age cohorts. If we think about pediatric cancers, even though we all know they're there and we're aware of them, cancer survivorship from 0 to 19 years only compromises about 1% of cancer survivors. 20 to 29 years of age, 1%. 30 to 39 years, around 3%. But, there's a saying that, cancer happens with age, and the older we survive and the older we are, the more likely we are to develop cancer. And that certainly shows here in the group and the number of cancer survivors. Those cancer survivors between the ages of 40 and 49 comprise about 6% of survivors. Then when you get up to 50 to 59, 60 to 69, and your 70s and 80s, in the 50s, the number of cancer survivors is around 15%, 60 is 27%, 70, 26%, and 21% are 80 years and older. So, the years 60, 70, and 80, they really comprise about 3/4 of all cancer survivors. So I think that's an interesting graph showing survivorship by age group. So really the discussion about survivorship began around the middle 1980s. In the 1970s and before, cancer survivorship was not really discussed a whole lot because the prognosis for cancer at that time was not nearly what it is today. So in 1985, one of the very first really looks into survivorship came from a physician by the name of Fitzmullan. Fitzmullan in 1985 was actually a internal medicine physician who developed prostate cancer. And as he went through his journey with prostate cancer, he began to look at some theoretical models about survivorship and was kind of considered to be the father of cancer survivorship, in that he wrote the first paper on cancer survivorship that was published in the New England Journal of Medicine back in 1985. The name of the paper was Seasons of Survival, Reflections of a Physician with Cancer. And in this paper, he looked at the possibility, could there be different stages to survivorship? And he actually identified 3 stages of cancer survivorship. The first phase is the acute stage, and he described that as the time from the time of diagnosis through the end of treatment. So in cancer survivorship, you become a cancer survivor at the time of your diagnosis. But the acute stage of survivorship is really centered around the disease itself. It has to do with diagnosis, treatment, and the actual treatment of the disease itself. Once treatment ends, the next stage in survivorship is really called the extended stage, and that's really at that point in which there's a documented response to treatment. You're no longer focusing on the diagnosis and the treatment itself, but really focusing on the fact that treatment is concluded, there's a documented response to the treatment, and all the things that happen after treatment. And during this period of recovery, it's when survivorship kind of shifts ideas and thoughts to look at what are the physical changes that have happened as a result of treatment, what are the emotional and the psychological effects of treatment. So it really looks at the after effects of treatment in the extended stage of survivorship. And then finally, the last stage of survivorship is what's defined as the permanent stage. And the permanent stage is really looking at, it's the long-term stage of survival. And it really occurs at that point where there's a certain level of confidence that the cancer survivor gains, where they gain confidence for their health and their life really begins to return back to that new normal. So if we talk about survivorship, there's the acute stage, the extended stage, and the permanent stage. So of course, anybody who is a cancer survivor, they face certain challenges, and with the diagnosis of cancer, there's an increased expectation for a good quality of life after cancer, and that's really that extended stage in cancer survivorship. We know that treatment with cancer certainly comes with, adverse events and side effects, and so when we talk about those side effects, there are really two different categories of effects related to cancer treatment. You have what are known as the late effects. Late effects are typically side effects of treatment, and they occur, during the time of treatment or after the time of treatment, and they tend to be side effects that last for a short period of time, typically up to 1 year after treatment. But there can be long-term effects as well, and these are long-term effects that can go on after that 1 year mark after treatment, and they can last, for more than a year, or even be persistent effects that go on indefinitely or long-term. So one of the things in survivorship is to really understand the difference between what is a late effect, which is typically a short-term effect that will dissipate within a year after treatment, or is it a long-term effect, something that may happen and go on even beyond that 1 year mark after treatment. Many of these side effects are, what we call medical consequences of treatment, or physical changes that happen as a result of treatment. They can be wide-ranging. They can be both long-term and late effects, so they can be temporary effects, or they can even be long-term effects. And it really depends on, what type of cancer is being treated, the age at the time of treatment. It also depends on what type of treatment. Effects can be as a result of surgery or radiation or chemotherapy. And if we bring this into the year 2020, I think we can add to that immunotherapy and targeted therapy. So we really have more modalities for treatment now than we did back then, and those would include immunotherapy and targeted therapy. One of the long-term effects certainly comes from surgery. We know when cancer surgery occurs, it can often cause changes in body image and cause permanent body alterations. The two most common ones that we think about are probably the mastectomy for breast cancer, or possibly colostomy for someone who had a type of colorectal cancer. So certainly surgery can cause changes in body image that can even be permanent body alterations. Other effects of treatment for cancer really depend on how much treatment you get. Is it a short-term course of treatment that's over in a few weeks or months, or is it a long-term treatment? Many of the effects are related to the dose. They're what we call dose-limiting toxicities, where you may experience some of the effects, but the longer you're on chemotherapy and the higher the number of doses that you get, it causes those effects to become more prominent over time. And then the other thing to consider is, are the effects related to concomitant therapies, where it's chemotherapy given along with radiation, or chemotherapy given in combination with chemotherapy? So really all of these factors go into what type of medical consequences occur as a result of treatment. So if we talk about those physical changes or medical changes that happen as a result of treatment of cancer, It really can affect all organ systems. If we look here, this is, a comprehensive list of the different organ systems. I'm not going to go through the changes for each and every one, but we'll look at some of the examples. When we talk about, treatment of certain diseases like breast cancer, you can certainly get bone and soft tissue changes because ER-positive breast cancer patients on hormonal therapy, as a result of that hormonal therapy, may develop osteopenia or even osteoporosis. You can have cardiovascular changes. We know some of the chemotherapies, particularly the anthracyclines, they can cause changes in the size and shape of the heart muscle, which can affect the functioning of the heart. When we talk about dental or oral, I think of head and neck cancer patients who have to receive radiation. That can certainly cause changes in the dental health and can cause problems there. Some of the newer therapies, the immunotherapies, they can cause endocrine changes. Oftentimes hypothyroidism can be a result of treatment from immunotherapies. Gastrointestinal changes, hematologic changes, skin changes. Under nervous system, I think anyone who's undergone treatment with therapy for cancer is familiar with peripheral neuropathy, which can be numbness and tingling in the fingers and toes. That's certainly a very prominent side effect of cancer treatment. Neurocognitive changes, anyone who's undergone chemotherapy, if any of you out there in the audience can relate to that term chemo brain, where you get short-term memory changes that are temporary after treatment. So there are medical consequences to cancer and cancer treatment. And so all of these organ systems here have to be taken into account when planning survivorship care and learning how to deal with the side effects from treatment in each of these organ systems. But in addition to any of the physical changes that happen, I think you have to look also at the psychological well-being, the social well-being, as well as the spiritual well-being. So cancer survivorship really looks at all the dimensions of quality of life. It's more than just physical symptoms. It also includes all of these other areas of quality of life. If we think about psychological well-being, many cancer survivors have changes in their level of control. Certainly someone who is self-functioning and used to taking care of themselves, when you get a cancer diagnosis, suddenly if you've been through the experience, you have other people telling you where you have to be. You have to be at appointments a lot. You lose a lot of self-control because other people are telling you you have to be here at a certain time. You have to be in a chair for treatment. You have to undergo scans and all of these other things. There can be anxiety associated with that. I think one of the biggest ones in the psychological well-being realm is the fear of recurrence. That's probably one of the most common things that I deal with in survivorship care, is helping deal with that fear of recurrence. Social well-being, we know that not only cancer affects the patient, but it also affects the family and caregivers, so that can cause family distress. Survivorship issues can certainly change roles and relationships. It can affect social functioning, appearance, enjoyment of life. Sometimes it creates feelings of social isolation. It can certainly affect finances and work. There's also a spiritual component to survivorship. A lot of questioning, why, what is the meaning of my illness? It can certainly decrease or even increase hope. It creates feelings of uncertainty and really existential questions. Why me? Why did I get cancer? What's going to happen? That kind of stuff. So I think when you do survivorship care, you have to focus more on all of the qualities of life instead of just the physical symptoms. So a lot of times people think of cancer survivorship as dealing only with the physical symptoms that come with treatment, but you also have to incorporate psychological, social, and spiritual elements of quality of life when delivering survivorship care. So this is a survey that was actually done back in 2011 by the Lance Armstrong Livestrong Foundation, and it was basically a survey that went out to over 1,000 cancer survivors. And they asked questions about what type of support they were getting as a result of their treatment. And the results are quite interesting. And remember, this is dated 2011. So back in 2011, at least 53% of cancer survivors reported that they had developed some type of secondary health problem as a result of their treatment for cancer. More than half dealt with chronic pain. At least 1 in 3 patients developed infertility as part of their treatment. So those were all secondary health problems reported in this questionnaire. Non-medical support, about 49%, which is half the population in this sample, stated that they felt like they had unmet cancer needs that were not being met at the time their treatment concluded. 53% of patients experienced practical and emotional consequences of their cancer and reported that those emotional consequences were often harder to deal with than the medical issues themselves. And I think that was a real eye-opener for oncology providers, is that we needed to shift our thought process from dealing only with the medical consequences of treatment to, also dealing with the emotional and psychosocial part of treatment. 70% of cancer survivors in this survey said that they dealt with depression. 78% of patients who dealt with depression, 78% of those did not seek professional services for things like depression and anxiety. There were 58% of patients in this survey that said that they dealt with loss of sexual desire or sexual functioning as a result of their treatment. 43% of patients experienced decreased income as a result of treatment for cancer. 25% of patients reported that they had gone in debt as a result of their treatment, and there were 12% of patients who turned down a treatment option because of high cost. If we talk about job and work, what related to cancer, 32% of patients undergoing cancer treatment said they had a lack of advancement at their job or experienced demotion or job loss as a result of their cancer diagnosis. And about a third of the patients felt as though they were trapped in a job, really so they could preserve insurance coverage. So really what came out of this survey from the Lance Armstrong Foundation was a real eye-opener for oncology providers, that when we begin to think about how to perform survivorship care and create survivorship care plans, we really needed to incorporate more elements of quality of life than just the physical symptoms, that we needed to incorporate all of these other aspects into the care. So when we talk about survivorship care, this is what we call the cancer care continuum. And the large purple arrow that you see there is really the survivorship trajectory. When we talk about cancer, there's a lot of stuff that's done before the diagnosis of cancer to try to prevent cancer, things like smoking cessation, physical activity, sunscreen exposure, all of those types of things. Screenings are certainly done, mammograms, colonoscopy, those types of things, but that's really to prevent cancer. But once the diagnosis is made, from the moment of diagnosis, that's when cancer survivorship begins. So the purple arrow really represents the continuum of survivorship care. It should begin at the time of diagnosis. It goes through the time of treatment. It goes after the time of treatment and goes all the way through to the end of life. And the green arrow below has the acute, chronic, and end-of-life care. And I think that can be translated into those stages of survivorship that Fitz Mulan talked about that we went over previously. So the acute care part of survivorship, the chronic care would be the extended phase, and then the final portion of that would be the permanent stage of cancer survivorship. So if we take all of that into account and we look at survivorship care and we begin to talk about oncology practices putting in formalized survivorship programs or actual processes to deliver survivorship care, and we look, across a whole host of different practices, there are some kind of standard things that were noted as we begin to look at survivorship. Previously it used to be done by the oncologist, the treating oncologist, and that was kind of routine practice. What's happened since the introduction of survivorship, it's now become a much more multidisciplinary team. It includes not only the treating oncologist, but also nurse practitioners, nurses, social workers, nutritionists, psychologists. It's a full comprehensive thought process now instead of just being delivered by the oncologist. One of the universal themes that has come out about cancer survivorship is patients find it very reassuring to know that their needs are being addressed after the conclusion of treatment. One thing that's still present is it's very variable as to how long survivorship is ongoing. Some practices do it and incorporate it and embed it into follow-up visits that go on long-term. Others use what we call a consultative model, where it's all done kind of sort of at the beginning, at the end of treatment. What we still need to work on is that there are guidelines for follow-up, and they're fairly new. This whole thought process of cancer survivorship and surveillance really began around 15 years ago in the year 2005. So guidelines and survivorship guidelines are ever evolving. They're only about 15 years old, and they're a work in progress. One of the things that all survivorship care plans have in common is that there's a focus on surveillance, on how are we going to look for and monitor for any recurring cancer, and there's certainly things put into place to try to help prevent recurrence. And one of the common things that was noted in early survivorship care that we're getting better at is that transfer of knowledge between the primary care physician and the treating oncology group. You know, the oncology group is very familiar with everything that was done to treat the cancer and the treatment that was given. And we're shifting now more to a focus to include primary care physicians and other physician specialties, so that they are also aware of what the treatment plan was, what the patient went through. So that's become a real focus of survivorship care in 2020. So why did it all begin? What started the conversation about survivorship? It really goes back to 2003. In 2003, there was a presidential council that was created to actually look at cancer survivorship, and they presented their annual report known as Living Beyond Cancer, Finding a New Balance. And this was really from the U.S. Department of Health and Human Resources. And that was one of the very first federal initiatives that was started to really look at and address the needs of cancer survivors. Following that, the Centers for Disease Control put out another piece on cancer survivorship known as a National Action Plan for Cancer Survivorship, Advancing Public Health Strategies. But what really started the ball rolling and really opened up the conversation for cancer survivorship was in 2005, the Institutes of Medicine and the National Research Council, they published a paper called From Cancer Patient to Cancer Survivor Lost in Transition. And that was a very pivotal moment in cancer survivorship. And it created really federal initiatives that were put out to all oncology providers that they needed to begin to incorporate aftercare as part of the cancer treatment spectrum. So what came out of that Institutes of Medicine report in 2005 was really federal mandates to all practices who delivered oncology care. In that 2005 report, part of the structure was that all oncology providers had to incorporate or implement some type of survivorship care plan into the treatment spectrum. There were mandates that those care plans needed to be structured in such a way that they could build bridges between the oncology provider and the primary care provider to try to help bridge the gap in some of that knowledge sharing about the treatment. There was a mandate that survivorship models needed to be incorporated into practice. There were national guidelines that were placed out on how survivorship care could be done. The Institutes of Medicine also said it needed to incorporate multidisciplinary teams, which needed to include psychosocial and community support services into survivorship. And also survivorship care plans needed to address employment and insurance issues as well. And there was also a mandate for further research into survivorship. So, you know, why do we need survivorship programs, and what's the reasoning for the need for oncology practices to have survivorship programs? So one of the challenges has been, how do you do this with a large number of individuals? And what we know is oncology practices, you know, they have a lot of patients. So part of what has been focused on is how do you deliver survivorship care to a large number of patients who need it. There's also some thought process that greater understanding of the consequences of cancer and its treatment will come out of survivorship programs. So as more and more survivorship care is delivered, we essentially learn more what are the consequences of cancer. Survivorship programs since 2005 have really looked at interventions, not just identifying problems with survivorship, but have really developed interventions and things to do and put in place to eliminate and reduce some of the long-term side effects of cancer. And really, survivorship education and training, meaning education and training to oncology professions has really been ongoing since 2005. There's been a lot of effort into educating nurses, nurse practitioners, pharmacists, psychologists, social workers on how to deliver survivorship care. So when we talk about survivorship care and really what that should look like, the Institutes of Medicine really put some guidelines in place. And so this should be something that should be done with all oncology providers in terms of providing a survivorship care. So really the components of survivorship care is, number one, there needs to be coordination. And the coordination is the sharing of knowledge between the patients, their oncologists, all of the primary care physicians and specialty physicians involved in the care of that patient. And that should really come as what's known as a survivorship care plan. And that survivorship care plan, I like to refer to it as a roadmap. What will happen once treatment is concluded, and how will that patient be followed after treatment is completed? Part of that is a treatment summary. You know, at the conclusion of initial treatment for cancer, all patients should be provided with a treatment summary. And that summary should have information about what their cancer type was, what the stage was, what types of interventions were done to treat that cancer. Did it involve surgery, radiation, chemotherapy, immunotherapy, hormonal therapy? And that's part of the survivorship care plan. Included in that care plan, in addition to the treatment summary, there should be a section that talks about prevention and detection, meaning how do we prevent recurrence of that cancer, and how will we detect that cancer if it recurs. Part of that is the surveillance plan. And the National Comprehensive Cancer Network, they have actually created cancer-specific guidelines. So there's one for breast cancer, one for lung cancer, one for colon cancer. You know, each cancer type has a surveillance protocol. So essentially, they tell you when you should have a scan, when you should have repeat colonoscopies, when you should have tests done, and what those tests are. And then the last part of a cancer survivorship plan should really include what type of interventions, what are we actually going to do for that patient after treatment to help deal with some of the physical changes, the psychosocial changes, social changes, and even spiritual changes as a result of cancer treatment. So this is kind of a snapshot of what survivorship care should look like. It should have a survivorship care plan. In that care plan, it should include the summary of treatment. There should be a plan on preventing cancer recurrence, a plan for how you will detect that cancer recurrence, what measures you're going to put in place in terms of surveillance for monitoring for that cancer recurrence, and if there were any physical, psychosocial, or social or spiritual changes, what types of interventions will actually be done to address those issues. So when we look at care models for survivorship, the largest majority of survivorship programs are adult programs, but there are pediatric cancer survivor programs too, and they bridge the gap between pediatric cancer treatment and adult surveillance after pediatric cancer. But I think for this audience, we're primarily talking about, you know, adult programs for cancer survivorship. They tend to be disease specific. So if you have breast cancer, your survivorship care plan is centered around everything for breast cancer. If it's colon cancer, whatever cancer type you have, each care plan will be different depending on the type of cancer that you have. There programs that should be comprehensive. They should include what's called the consultative model as well as the ongoing care model. So what we mean by that is survivorship at the end of your primary treatment for your cancer. There should be at least a one-time visit, and in that one-time visit, it really should focus on giving that treatment summary, and not only presenting that treatment summary, but presenting the overall care plan, which is a systematic care plan for how you're going to do surveillance to look for recurrent cancer. But also in that survivorship program, there should be incorporated what they call the ongoing care model, which really extends survivorship beyond that consultative one-time visit throughout the continuum of care. And that's oftentimes embedded within the treatment team. So there are different touch points along the way where survivorship care can be delivered in an ongoing fashion. Most survivorships are done in community care setting. One of the things that we know is that it depends on the practice where you are. You may be treated at various different locations and throughout the audience that we have this morning. So survivorship may look different from practice to practice, but there are some commonalities depending on how that particular practice delivers survivorship care. All practices or oncology groups who are delivering survivorship care should do some things in common, and that is create a care plan, and in that care plan there should be information about the diagnosis, the treatment, and the long-term effects, and that should be something common between various practices. It really boils down to what's known as a survivorship care plan. So when treatment is concluded, your oncology provider should provide you with a survivorship care plan. That care plan should include treatment for short and long-term follow-up. It should have a plan on how to deal with late and long-term side effects. And one of the most important parts of a survivorship care plan is it should have some vehicle or some delivery method where that care can be coordinated amongst different providers. So it should include not only the oncology practice, but it should also include other community resources. And everyone on the phone call this morning is part of the Northside Cancer Community, which is an excellent community resource for care. So one of the big obstacles that has to be overcome in survivorship care is how is coordination done between various specialists. And the Institutes of Medicine, as well as ASCO and NCCN, as part of their care plans, they definitely encourage coordination and communication between primary care physicians and the treating oncology group. Here at Georgia Cancer, we actually create a care plan that can be sent electronically to patients' primary care physicians. So there is an electronic component in our particular care plans, how they're shared. But in that summary, there needs to be, what type of surgery, whether or not the patient had radiation or chemotherapy, and any event that happened during treatment that needs follow-up. So I hope that was a little bit of a review for survivorship and helped you guys understand not only what it means to be a survivor, but the types of things that your oncology group or your oncologist is doing for survivorship. But I think cancer survivors themselves and you guys in the audience, really what is your role in survivorship? So these are some of the things that you can do as a patient or a cancer survivor. Number one, be aware that survivorship planning and care should be part of your treatment plan, and it should be offered to you by your provider. Don't be afraid to ask your provider about what will be offered to you for survivorship care, which really brings me to the third bullet point. If you're undergoing treatment for cancer or about to finish treatment, ask your provider to give you a survivorship care plan. They will know what you mean when you say, I need a survivorship care plan. So communicate with your provider, ask your oncology provider, what physical symptoms should be included in your survivorship plan. Make sure that your survivorship plan gets shared with your primary care physician and any other physician that was seeing you during your cancer treatment trajectory. And don't be afraid to talk about any physical changes that have happened as a result of your treatment. Talk about social issues, things like job, employment, financial burden, that type of stuff. Don't be afraid to talk about psychosocial changes, whether or not that's depression or anxiety or fear of recurrence. Also, feel free and open to talk about any spiritual concerns you have with your provider. Really, when you sit down at the end of your treatment and your provider says, okay, now we're going to talk about survivorship, I think it's important to educate yourself about cancer survivorship so you understand what survivorship means and work collaboratively with your provider to create a cancer survivorship care plan. Thanks to the cancer support community. That's who's actually sponsoring this program this morning, the Northside Cancer Support Community. They are a very helpful resource. They are available for all different types of things. And I believe Emily's on the program with us, and she may want to talk a little bit about what the Northside Cancer Support Community is all about and what they do. So I'll turn it over to Emily, and she can talk to you guys about what Cancer Support Community is.
Absolutely. Thank you so much, Kennon. Like Kennon said, we are Cancer Support Community Atlanta. We are affiliated with Northside Hospital Cancer Institute, and we offer virtual programs like this now that we are all in quarantine. These programs are free to anyone who's ever been touched by cancer, whether you have a relative, whether you're experiencing cancer diagnosis for yourself, whether you're a longtime survivor. We want to offer you these programs to help you get through and get the resources that you need. So we offer different stress reduction classes such as yoga and Tai Chi, nutrition seminars. We will have an upcoming in the next couple weeks. Education programs like the ones you saw today. We also will have another education program later this week on colorectal cancer. We also have an education program next week on advanced care planning, and that is with the medical director at Northside Hospital of the palliative care team. So again, if you're interested in participating in either of those programs or any of our regular programs, you can go on our website, cscatlanta.org, and register for those. You can also, if you have any questions, reach out to me directly, Emily, E-M-I-L-Y, at cscatlanta.org. All right, and of course, you can always check us out on Facebook to find out about upcoming events. And Kennon, I think we did have a few questions. First one, being a 3-time survivor, is there a way to receive a combined survivorship care plan?
So yes, each one of the cancer diagnoses has a specific surveillance protocol that is really directed by the National Comprehensive Cancer Network, or NCCN. So if you have 3 different cancers, you should be able to get a care plan for follow-up for each of those types of cancers. Each survivorship care plan should be disease specific. So approach your oncology provider and discuss each of your cancer diagnoses, and they should be able to give you a surveillance plan for each of the diagnoses. And each one of those care plans should have a section on how do you treat side effects and long-term effects for each of the cancer types. So yes, that is possible. And I have a few patients who have more than one cancer, and we try to do support programs and survivorship programs for each of the cancer types based upon what happened as a result of each cancer. Did that answer the question?
Yes, thank you. Another one, being a cancer survivor, are there any other resources for people who may need help in Atlanta in addition to Cancer Support Community?
Oh, there are a lot of different ones. There, one that comes to mind is Georgia Core. I think their website, and Emily may help me with this, it's cancerinformation.org, georgiainformation.org. I'm sure the Cancer Support Community and Emily, they probably have list of things that are available, but you can simply do an internet Google search for cancer survivorship help in Georgia, and there's a whole host of online and actual facilities that help. Of course, Cancer Support Community, you can reach them at cscatlanta.org, and they have a whole host of survivorship things to help.
Absolutely. And if you have questions about those, if you're still in treatment or are recently out of treatment and have access to your social worker or nurse navigator, they're another great resource, as well as your physician. Northside Hospital has their Network of Hope, which is a wonderful organization that connects cancer survivors to each other, as well as their Camp Hope. There are a lot of resources out there. You can email me directly if you have questions, but absolutely connect with your network through your physician office, and they will be able to provide those to you as well. Kennon, is there anything else you wanted to say before we wrap up?
Say thank you to everyone out there. Thank you for the opportunity to talk to you this morning. We just finished June, which was National Cancer Survivorship Month, and June the 7th this year was National Cancer Survivorship Day. So for all of you out there in the audience, just know that there's actual national recognition of cancer survivors, and each year there's a designated day for Cancer Survivorship Day. And my hat goes off to all of you who are out there and have been fighting cancer, and I hope you're doing well with your survivorship.
All right. Thank you, Kennon, for everything that you do, and everyone for joining us today. I hope we will see you all again soon. Take care.
Okay.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.